Thank you for attending this breakout session. This session is filled with powerful information to help improve your health and empower you. Radio Free 102.3 KJLH. We are you.
Black mothers and babies are dying at higher rates than any other racial group because of the stress of racism in our society. This fact, plus the COVID-19 pandemic's impact on Black communities, demonstrates that it's time for all of us to come together to be a village for our Black women. Black babies in LA County are 2 to 3 times more likely to die before their first birthday than babies of other races. Wow. Black women in LA County are 4 times more likely to die as a result of pregnancy complications than women of other races. These are incredible numbers. This crisis is impacting Black families of all income and education levels and lifestyles. This is not normal, people, and it is not for the reasons you think. The stress of racism in our society and across generations is at the heart of the problem. Doctors don't listen to Black women, they say, when they say something is wrong, and you have to insist on them doing something. Across the United States, Black infants die at a rate that's more than twice as high as that of white infants. In 1 year, that racial gap adds up to more than 4,000 lost Black babies. These are the facts, people. People of color are treated differently the moment they enter the healthcare system. Persistent racial disparities have caused Black women to experience the highest infant mortality rates among any racial or ethnic group in the United States. In order to decrease the national infant mortality rate, factors that maintain these disparities must be addressed directly. And what better place to address it than the KJLH Women's Health Expo. Good afternoon, good evening, good morning, because we virtual, y'all. I'm Tammy Mack, the host of the Tammy Mack Show on Radio Free 102.3 KJLH from 3 to 7 p.m. And these are our panel experts. Please welcome to the panel, Raena Granberry. Raena Granberry is a Black maternal health advocate and consultant. She currently serves as the Prenatal Equity Initiative Coordinator for the Division of Maternal, Child, and Adolescent Health at the Los Angeles County Department of Public Health. Raena is a Spelman alumna, an LA native, who has worked in politics with the California Democratic Party and elected officials, including Congresswoman Maxine Waters. Adjoa Jones is the Associate Director of Regional Collaboration for Service Planning Area 6 with the Whole Person Care Program of the LA County Department of Health Services. Adjoa Jones is the Associate Director of Regional Collaboration for Service Planning Area 6 with the Whole Person Care Program of the LA County Department of Health Services. I believe I just said that, but sometimes, it bears repeating twice. And she's worked within the Department of Public Health and DHS for the past 22 years, serving in various programs to improve the health and wellness of women, men, children, and their families throughout the county. Mashariki Kudumu, March of Dimes Maternal and Child Health Director for Greater Los Angeles. Mashariki Kudumu is March of Dimes Maternal and Health Director for Greater Los Angeles. She directs programs, provides community and provider education, and informs policies that improve the health of all moms and babies. She represents March of Dimes on local and statewide birth equity initiatives and is a member of the Los Angeles AAIMM Countywide Steering Committee. She has lived and worked in the San Francisco Bay Area, New York City, and Latin America, and has a background in social work, and is also a trained doula with experience providing support to pregnant women living with HIV, AIDS, or are injustice involved. That's one thing we're definitely going to talk about, because a lot of people don't even know what a doula is. So I can't wait to get into this conversation, but I have to also introduce Gwendolyn Manning, Black infant health. Gwendolyn has served as a preventative health leader for the past 23 years, and she's currently overseeing the implementation of the Black Infant Health Program, one of 13 statewide client-centered group interventions aimed at improving the birth outcomes of African-American infants and mothers by empowering pregnant and parenting. By empowering, I don't want to say by empowering pregnant women and parenting. I guess that makes sense, right? And then, of course, there is Michelle L. Sanders, a Los Angeles native and mother of three, certified doula, certified lactation educator specialist. Ain't never heard of that. I'm telling y'all, we about to learn some stuff today. And a certified surgical technologist and the project coordinator for the LA County DPH AAIMM Doula Pilot Project. Michelle delivered her first baby 21 years ago and has supported many family members, friends, and clients through her private practice. Beauty for Ashes maternal wellness and saving Black moms and babies is her passion and purpose. Michelle, I have to say this before we get started, Michelle. When I was reading your bio, going over your bio, it said that you caught your first baby at a certain age. And I thought I should change it to delivered. But then I was like, well, maybe that's it's said for a very specific reason. Is it said for a very specific reason?
Absolutely. Because that baby was going to come whether I was there or not. I literally caught him. His mother birthed him and I caught him.
Because when you're in the hospital and you're in the the delivery ward, they say that doctors deliver babies. So is it doulas catch babies and doctors deliver babies? What is the difference between the two?
Well, doulas don't typically catch babies. That's actually beyond the scope as a doula. So we can back up a little bit. We weren't at the hospital. We were in the car. So we didn't make it to the hospital, which is why I had to catch him in the back seat.
Oh.
Yeah. So, I wasn't necessarily wearing my doula hat at that moment. But, so we don't like to say deliver because, babies are not like, you order food from Uber Eats and they deliver it. This is a baby. They're born, they're birthed by their mother. So, therefore, I don't say like, doctors deliver babies because no matter who's there, whether it's the doctor, the midwife, or if no one makes it there, this baby is going to be born. And someone should catch that baby when that baby's born. So that's all I did. I really didn't have a whole lot to do with it. Mm-hmm. I was just the person who was there to catch him.
Well, before we get into doulas, that was just a personal question I wanted to ask, but hopefully it helps somebody. Look, I'm trying to get educated myself here, Michelle. We keep hearing there is a crisis in the county and AAIMM. We want to talk specifically about what AAIMM is. So who can speak to exactly what it is and what LA County is doing to address it?
I'll speak to that. Basically what AAIMM is the African American Infant and Maternal Mortality Initiative. We have a countywide initiative. We first began, now many of us go back in this work. I go back to Black infant health in the early 90s. I was one of the first community health workers and perinatal health educators. And so many of us have the experience and knowledge of this issue of Black infant mortality that has been going on for over 30 years. And really, if you date it back, it goes back to almost 2 centuries when they first started recording the Black-white mortality gap, the infant mortality gap in the 1800s. But what we began to do in the work that I'm doing with Whole Person Care was to identify specific issues under our 6 issues of focus that dealt with equity or inequity in healthcare, one of which was maternal high risk. And so since LA County Center for Health Equity had just launched their office, and Dr. Barbara Ferrer had mentioned that they were going to address the issue of Black infant mortality as it relates to racism and the impact of racism on the African American infant. And so at the same time, the nation was raising this awareness in about 2018 about the issue of Black women dying at almost 4 times the rate in California. And in some states like New York, 11 times and higher, the rate of white women. And so, yeah. So what happened was part of my job was to either start a community action team or join one that was in place. So at the time, there was no specific community action team for our region in place. And so we have 2 areas of LA County that have, 3 really, but I would say we are broken down into 8 SPAs, which are service planning areas within LA County, or regions now. What they want to be called is Antelope Valley is SPA 1, and then SPA 6 for South LA, like Compton, and then SPA 8, some of the South Bay cities, including Inglewood, have the highest rates of Black infant mortality. And also, as we begin to look at the data, we were able to look at the fact that most women that had died from maternal mortality, they were either living in SPA 6 or 8. And so as part of the vision that came to me was creating a community action team that included maternal mortality. We wouldn't just address the death of infants without addressing the death of their moms and the potential death of their moms. As you know, and we'll share more about that data on what the risk factor looks like for Black women birthing in the United States of America. And so we started having these conversations back in early 2018 and came up with the South Los Angeles, South Bay African American Infant and Maternal Mortality Community Action Team. And we launched our first meeting at Kaiser Baldwin Hills. We had over 100 participants. I believe all the ladies here were there, might be just one, but at any rate, we started this coming to the community to say, is there an interest in having a community action team to address this crisis and save Black moms and babies? And the community said, yeah. And so we had our first official meeting in January 2019, and we've been going ever since. We have a listserv of about 600 folks now. And then actually in about, I want to say early 2019 as well, the AIM countywide initiative was launched. And so that brought out a development of a steering committee. So now we have not just one CAT community action team, we have an AV, AIM CAT, those are the acronyms, and then we have a San Fernando Valley, and we also have a San Gabriel Valley. So there's a need, and why we're not just addressing the areas that have the highest rate is because it crosses all socioeconomic factors for Black women, and it has nothing to do with whether they're college educated. It has nothing to do with whether they are wealthy or lack resources or lack health care provision. It has everything to do with being Black in America and what has happened to the descendants of the African slave here in America.
Now that's interesting because you obviously think that the reason why Black mothers are dying during pregnancy is because of the disparity in health care. But it sounds like it's a little more than that. Can anyone speak to that?
I'll let one of my other colleagues.
Sure, yes. So it has a whole lot more to do with just the snapshot of pregnancy or healthcare during even a woman that is preparing for pregnancy. We use in our program, which is called the Black Infant Health Program, we use a framework of what we know to be called the life course perspective. And in this framework, it really kind of deals with risk factors versus protective factors. But then in addition to that, it looks at what are things that stress people's lives, and then what are things that give them protection from that stress. Because if you look at the underlying factor of what life course perspective is about, it deals not only with the life that we're looking at the moment of a woman's pregnancy, not just her life, but it looks backwards at her history and the lives that came before her. So when you look technically over the course of a person's life, we usually think about life beginning at birth, ending at death. But in the life course perspective, it's much, much more than that. It deals with the precursors of what health outcomes a person can have based on what their parents or their mother's circumstances were at the time she was carrying them.
Let me say this, Gwendolyn.
All the way.
Let me say this, Gwendolyn. This is like blowing my mind right now. And let me tell you why. Because number one, I thought that the reason that that there was such a high Black mortality rate when it comes to pregnant women and those births was because of the disparity of the healthcare system for Black people. And also, when you look at your history of health, you obviously track your history within your family and your generations. But who would have thought that you track the stress of your generations? Like, that is mind blowing to me. And even when Adjoa said, that it links back even to slavery, that I just don't even, how do you have someone as simple as me make that connection? Where does that connection come from? Why does my baby die or I die because of something that happened way back then?
Well, you still have to go back and look at like what we're dealing with now, that the implicit bias and the racism associated with just being Black, how Black folks are treated. We're looking at the fact, and we have several examples, and then we have one here that may share her story, is that we have examples of Black women going into providers and stating their case and their issue, what is going on with them, and being ignored, being overlooked, not being heard, saying that is not your problem, this is your problem. Or, you know, oh, take some Tylenol, some aspirin. There's stories, if you look at NPR and ProPublica did a story called Lost Mothers, and it dealt with Shalon Irving's story, and she was worked for CDC, several degrees, and died within a couple weeks of having her daughter, and was 30-something years old. We lost Catherine Terry earlier this year in Antelope Valley at 24 years of age.
Wow.
I mean, there's a number of reasons, but it is associated with not stress really, but what is the factor of that stress? How did that stress come about? Who is leading out with that? You know, so many young women, they don't get, and Black women don't get all of the same resources and services and application of, you know, if they come in for this, maybe, you know, we've heard stories from physicians where a doctor is told, well, you could do that on her who's white, but you can't do that on her who's
Wow.
Black. And they had the same exact issue. And
Wow.
so, you know, it has a lot to do with that. And we can even talk about, you know, why Senator Holly Mitchell created the bills SB 464, Pregnancy and Dignity in Childbirth Act, which was passed in 2019, which had to do with just this right there, and having to retrain physicians and retrain staff on how they deal with Black people.
Yes, because I was talking to a few doctors, and they said that there is a such thing as medical racism, medical bias. And even in the way that they learn during med school, they're taught how to treat white people and not how to treat Black people. And it's amazing how you can track the systemic racism throughout every facet of America. It's just amazing to me. Mashariki, let's talk.
And I think also too is not only the history, but this is news that there was a study with medical students out of Virginia in 2016-17. The study came out that these medical students thought that Black people didn't feel as much pain that white people did. So these are doctors that are coming up now that have these racist beliefs. And with the racial reckoning that's happening right now, there was a nursing journal where they have to come out and apologize for some of the racist stereotypes that they had in the nursing textbook that people are learning about right now. So this really is structural racism. We talked about, Ms. Gwendolyn was talking about the protective factors when we think of education, when we think of income, when we think of insurance. And in California, because of the Affordable Care Act and Obamacare, that most pregnant women all have access to insurance during pregnancy. And so when you look at Black women who have private insurance, Black women who have PhDs in higher education, Black women who don't smoke have a higher preterm birth rate, a higher infant mortality rate than white women who dropped out of high school, white women who have public insurance. That goes back to structural racism. Toxic stress is all about the skin that we're in. It's nothing about our race. It's nothing, all those things that we think about protective factors are protecting us because of racism.
It's, I mean, I thought I knew, but I had no idea. This is fascinating. This whole topic is fascinating to me, that our Black women have to go through this too. And when you talk about how when the doctors in med school detect that Black people don't feel as much pain as white people, yeah, it's because we've built up such a resistance and tolerance for pain that it's almost like, oh my God.
Yeah. And that's where, yes. and you know, and that's how, you know, I frame it when talking about like the intergenerational trauma. So, you know, our elders are parenting from a perspective of like a traumatized perspective.
Yes.
So
Oh my God.
right?
Yes.
So the way that we have been taught to parent and take care of ourselves comes from trauma, past trauma, you know, coming from slavery. So you put all of that into this little box, and then you're like, why can't you take better care of yourself? Why can't you have a healthy baby? Why can't you guys do this? Why can't you do that? And nobody has healed the trauma or even addressed it, but people are still having babies and trying to live through this. And so, you know, now we have this crisis here that has been ongoing. It's not a new thing. And, you know, we really need to address the intergenerational trauma that has occurred and it's being passed down.
Why is it, do you think, ladies, that this has come to the surface now? Each of you have said that this is not new, but it has become much more publicized within the last 2 years than ever. Why is that? I would actually say the last 4 years, maybe, because Hillary Clinton did talk about it during her election, or during that election year.
There's several reasons for that, right? I mean, there has been, like Adjoa said, we stand on decades of work and pushing on the shoulders of all the work that's been done. And it just, now we have like a lot of elected officials in place too, that kind of can carry that torch, and there's a lot of political will around it. And then when you add on the stories of like Beyonce and Serena Williams, you start to get a little bit more of that push, and you know, the folks wanting to have some accountability for the things that have happened. And I think the other thing is, when we talk about the political will, just like the AIMM work that Adjoa talked about is co-sponsored by both the LA County Department of Public Health and First Five Los Angeles. The leadership there has said that we have to take this on. This is because of racism. You know, if it's the environmental problems, racism, we have to really go back and attack that. So we have leadership, political will, just the decades of pushing, and having a lot of more of our people in place to move the narrative forward.
I know that most of you who are on this panel have a personal and deep connection to this work. And I would like for you each to share why the work is why you're so connected to the work. We'll start with you, Michelle.
Well, for me, so I was a teen mom. My oldest daughter is now 26. I have a 20-year-old and a 16-year-old son. But I didn't know a lot of things then that I know now. And my mother did, because she worked with a midwife. She was a midwife's assistant. But, you know, I was 17, 18. I thought I knew everything. So I didn't want to do the things that my mother wanted me to do. But then, you know, fast forward, I became a surgical tech. And I ended up working in labor and delivery. And I ended up doing cesareans a whole lot. And I saw women who did not need cesareans. I saw women who were being treated poorly because of the color of their skin. I saw doctors behaving as though this is just a game, it's just another day at work. And I was too emotionally attached to these pregnant women coming through these operating rooms to continue to in that work. Like, I cannot earn my living this way. So, you know, I would have instances where I would be at work and I would kind of, you know, get in trouble because it's like, hey, you know, we need you here, but I'm here trying to consult this mom, trying to explain to her what is being done to her, trying to explain to her what her options are. So I'm trying to, you know, doula this woman when I was supposed to be actually in the operating room. And so it's like, you know, hey, we don't pay you for that. That's not what you're here for. And so that's when I started thinking, like, I need to be doing this full time because this is where I'm most useful. Somebody else can cut. That does not have to be me. And so I ended up leaving the operating room in 2017 and have not been back. And, you know, I have that perspective from the medical background. I have been privy to some conversations about Black women and, you know, the misconceptions about Black women. You know, she doesn't know who the father of her baby is. And it's like, this woman is on a table having a cesarean. How do we know that she doesn't know who the father of her child is? You know, and turns out that he was deployed. That's why he wasn't there. You know, it wasn't that she didn't know or that he wasn't involved. But people think that that's what's going on with Black women. So, I have had, the opportunity to support women who couldn't afford my services, but I saw how important it was. And so I just made sure that I always positioned myself to be able to either provide the support or connect women with the support that they needed. Because, I'm one person, but collectively we can change this narrative. And so that's what I'm committed to do.
Mashariki.
Sure. And I think this goes back to the toxic stress. So there's 4 girls in my family. We all have college degrees. One of my sisters is a physician. One of my sister went to Stanford and is getting her PhD in science education. Another one went to Duke. And we've all had babies before 37 weeks. So we've had babies at 24 weeks, we've had babies at 30 weeks, we've had babies at 27 weeks. So this isn't about our education, this isn't about our income, it's about the toxic stress and the racism that we've experienced in our life and in the healthcare system, in terms of thinking my sister calling the doctor because she was bleeding, and the doctor said, well, you're changing doctors, so I can't see you. You have to wait till next week. Didn't say go to the emergency room, didn't say go to urgent care, but that just dismissive care that Black women get. And at the March of Dimes is really what I feel like in my role, we're a large national and old mom and baby health organization, and just really I feel like in my position, in my role in LA is to elevate the voices of our community, to elevate the voices of Black women, to inform our policies and our programs and activities that we do. So it's personal because it is my family, and I feel like I have in my role in the March of Dimes, opportunity to make change not only within our organization, but make change in the community to make sure that all families, all Black moms and babies and families have the opportunity to have a healthy and joyous birth.
Raena, what about you? What makes you so connected to this work?
I'm, one of those women who had the adverse birth outcomes. I had a stillbirth in my first pregnancy. I thought I did everything right. At that time, I was in shape, like Mashariki said, college educated. I had my partner, I had support, but I was struggling with employment, and I was on Medi-Cal, and I received very discriminatory care for being an unmarried, woman on Medi-Cal.
When you say you received undiscriminatory care, what exactly does that mean?
Discriminatory care. So I recognize that other women, I went to a more prominent doctor in a more prominent area, and other women would get more time with the doctor, mostly white women and Persian women. It was a Persian community, and I would be in and out in 5 minutes. And I trusted the doctor because you're a doctor, you've been doing this forever. I'm a first-time pregnant woman, and if you say everything's fine, even when I have concerns, back then I believed that everything was fine. And the very day that I had my stillbirth, in the morning, I actually called the doctor's office and said, something is really wrong here. And the nurse told me I could just wait until next week because that's when my appointment was. And I went into labor that night.
So that goes back to not listening when Black women say, hey, something's wrong here, something's out of pocket. No, you're good.
Absolutely. And that just brought me to the advocacy. And then I got involved at Black Infant Health that WINS represents. And, I had all the support in my family, but we didn't have the real knowledge that deep down, what you need. And I connected to that, got a lot of that knowledge. And then just made it, my life's business to share. I ended up having another preterm birth at 27 weeks as well. But with my daughter, I went full term because by that time, I understood I had all the connections and the resources. I started working at Great Beginnings for Black Babies that connected me to all kind of resources and support. And so I just wanted to make sure that another woman wouldn't have to experience what I experienced because it was a preventable stillbirth.
Yeah. Gwendolyn, she's talking about your organization that you're so connected to, Black infants. Let's talk about why you are a part of this work.
Well, I think first of all, everything that these women have already said, and then I'll say personally for me, I guess I'm just a person, I like to challenge the norms because what we consider normal is not normal at all. It links back to racism, as we already said. But when I think about why Black babies die at a rate that's 2 to 3 times that of any other group, like that is something that has been accepted almost. And I'm from the American South. I'm from Mississippi. I grew up with the term crib. I think we called it crib death back then.
Yeah.
And it was like, it wasn't even abnormal. Like you would see a woman pregnant, and then after her baby was born a few weeks later, or a few months later, you would hear somebody say something like, oh, her baby had crib death. And that was always normal. But when I got older and I learned about maternal and child health, and then in particular about the differences in, between what Black babies experience and white babies experience, it was a no-brainer for me. I needed to get involved with this type of work, because one of the things that I think our program does well is we really do center Black women's experiences, so that we can show and prove through research and data that it doesn't have to be like this.
Tell me this, what is...
There's no natural reason why Black babies have to have these disparities, none.
You mentioned that there was a disparity between how white babies and Black babies are treated. And I'm imagining we're talking about through the birthing process as well as after. What are one or even two things that are dramatically different in the treatment?
Do you mean of mothers or babies?
Let's talk about the babies first. White babies versus Black babies. What's one of the major differences that white babies get that maybe Black babies don't?
Oh, I can comment on one thing. Oh,
No, go ahead.
Okay, so one is around, we talked about the care that a lot of women receive, right? And if you don't feel a connection to your doctor, if you did not have a satisfactory birthing experience in the hospital, you need to go get those checkups, and you need to be having those well baby visits after you have your baby. If you've had a horrible experience there, you don't trust those people. You don't think they have your health in mind, or your child. So a lot of times, as white women and other races of women, ethnicities of women go back and have these relationships, Black women figure sometimes, why should I go back into there? So sometimes we're missing that portion. And then in another instance, you've even seen the same way they feel about Black women is sometimes the way they feel about the Black children. I mean, we had stories about, like, in NICU, and I don't know if, Mashariki can speak to this, but, folks making assumptions about the parents in NICU, and then that has an impact on how those professionals handle how they deal with the child. So there's all these intersecting factors that affect the baby.
And when you say,
and there's,
go ahead.
I was going to say there's research that's come out too in terms of Black babies and white babies in the NICU, which is a newborn intensive care unit. So you think of preemie babies and babies that critical condition go to, that the Black babies have worse outcomes. That we also hear about breastfeeding. So after a mom, whether she's had a full-term birth or preemie birth, that Black women don't get the same postpartum breastfeeding support in the hospital that white women do, and that impacts their breastfeeding rates and our ability. I remember when my baby was in the NICU, he had to go in for jaundice, and the nurse said, okay, we'll just give him a bottle, and I was like, no, he's gonna get my breast milk. I don't want formula for him. And I had to get emotional and start crying about it. And then the neonatologist is like, no, you'll pump and we'll get the breast milk into him, and we'll do it either through a dropper. But she, the nurse automatically went to formula and wasn't willing to work with me about how to get my breast milk into my baby. And so we hear stories like that time and time again.
Adjoa, I know that this work is near and dear to your heart. Why?
So my why is similar to some, but my why first began, I was a 15-year-old teen mom, and I graduated from high school at 16. And some of my experience, I decided on my own to go and stay at a home for pregnant and parenting girls, which is St. Anne's, which is here in LA County. And it was just really because my parents had both remarried and I wanted to get out of the house. And I saw some things there that were very unfamiliar to me, because I came from what is considered a great family, a great home. Both parents are college educated. What the experience there, I saw a lot of different young women that didn't have support as young as 11 years old. And I wanted to do something about it. So at the time when I entered college at 16, I thought I would go and become a physician. I wanted to be a pediatrician. HIV and AIDS was big then. And I said, nope, not going to be able to experience seeing babies die. I think I'm going to change my mind. And at the time I was working as a student for Department of Health Services in their immunization program, and met an amazing nurse by the name of Delilah Crenshaw, who they were launching a program, a mobile immunization program, and said, you know what, I'm about to go work for this program called Inglewood Healthy Mothers and Babies under Great Beginnings for Black Babies. I think you would be great to come on board and be our community health worker. And I did. And at the time, I don't know if you remember, Tammy, there was a billboard on Crenshaw and King that had the baby connected. You could see the mom's fetus, but the baby was connected to a 40 ounce.
I do remember. Yes.
Yeah. So I was one of the ones going out.
An unforgettable billboard.
Yeah, an unforgettable billboard. Everybody remembers that. So I had to go out and educate our community on why. So then it was victim blaming. It was more about what African-American women were doing, whether they were using alcohol or using drugs or smoking and
but a lot of people were upset about that billboard.
And I had to be the one to go out. I would have meetings at churches in the community and taking those posters and whatnot into doctors' offices, because what we were doing then was working hard to get African-American women into care in their first trimester. And so Zola Jones, who was the founder of Great Beginnings for Black Babies, started working with a lot of doctors, Black doctors, to come in and work with the Black churches and the Black doctors to build a collective to address those issues for Black women, because then too, it was still about the biases and the racism. So better to be seen by someone that looks like you, right? So that then they can, at least you feel they would have some understanding of your experience. And so that was a great time for me. I then went on to become their perinatal health educator. We were in the Hawthorne Mall at one point, and then we lost funding. And so I went into other aspects of the health field, but at the same time, I wanted to learn more about how to advocate for Black women and girls. So Jan Robinson Flint started Black Women for Wellness, invited me to come along. I met her at Great Beginnings for Black Babies. She worked there, and she started this organization along with 6 other sisters. And I went over there and helped her with the Shangazi program, which was, Shangazi means auntie. It's a mentor program. And we started that for pregnant girls. And what I couldn't do in my field of work where I'm paid as an employee, I did as a volunteer. So I learned a lot of advocacy, engagement, and I did a lot of work to ensure that, Black women and girls' issues were uplifted. That's a challenge too. Like, all of the things that Lady said are very important, because then, we come into the room and we're advocating for our own people, but it looks like here comes that loud Black woman that is still stuck on Black folks' issues. Yeah, we
are losing, let me tell you, Black people are losing the propaganda game. Any way we approach something, it always has to be in a negative way, as opposed to us. I mean, the Karens of the world can make stinks about anything and not be labeled at all. Let a Black woman make a stink about something, and all of a sudden we the angry Black woman with attitude. Right. And it's not about our attitude, and it's not about our anger. It's about our passion and our zeal for our people.
Right. And so I too, not just advocating in this field, but advocating in the church world, because I was, treated negatively and had suffered church hurt, because here I was, an unwed mother. My daughter's 34 now. I have 2 beautiful grandchildren, 8 and 10. But again, there was some stigma attached to that. And so what I wanted to do was advocate for young girls and celebrate. See, our goal is to celebrate the birthing process. If what is wrong with celebrating Black women and birthing? At one point, we were forced to give birth without our rights.
Permission.
Our permission. We were the chattel. Yeah. And so we had to produce at the whim of white slave owners, Mr. and Mrs., right? And
so you taking us there. You taking us there, girl.
Yeah, I'm going to be honest, And so now here's a time when why can't we, I used to be on the West Side, right? and I would see they had these pregnancy journals and magazines, and I was like, oh, these are so nice, and it'd be yoga and all, but I didn't see anything that applied for my people or that my people could afford. I'm like, why can't we have this on the other side of town? Why can't we have these same programs and services? So that's why this AIMCAT, this vision came back to me of this community action team of public and private partnership. So we're bringing community and government together to address this issue. You cannot be the one who caused the problem and tell us how to fix it. No, we're going to tell you how this is going to be fixed. We want your same support and allyship because, again, it's a public health crisis and issue, no different than all these other issues that are going on. So it's imperative to us to look at ways to, as a collective, to come together from doulas, nurses, doctors, midwives, pastors, mamas, daddies, grandmamas, aunties, uncles, cousins, friends, the whole community.
It takes a village.
It is the village approach. And so that's why, that's where my passion arose from, is pulling people together. People know I'm like a super outreach and network queen. Let's come together. And because I don't have all the answers.
Well, I tell you what, Adjoa, there's no doubt about your passion. As a matter of fact, Black Women for Wellness has a new documentary out, and it's called, well, you talk about it real quickly.
So Birthing While Black, some of us came together. It was Black Maternal Health Week in April. Raena helped me out. I think it was 2018 because we had Raena on the panel along with another sister, Morgan, who was with the Black Infant Health Program from the Children's Collective. Dr. Allen had just joined for public health as a health promotion bureau chief.
And what is Birthing While Black about exactly?
The Black woman's experience giving birth, the good and the bad. We have some great stories, and we have some horrific stories. Just like what Raena said, we have at least I want to say 2 or 3 women in so far, and we're going to, so Birthing While Black is going to address the issue of birthing in California, the Black woman's experience birthing in California, but not just the moms, we have the dads too, because I know you've heard the story of Charles Johnson, who is Judge Hatchett's son, who lost his wife at one of the hospitals here in our city. And same thing, same reason. Here's this educated woman, spoke several languages, race car driver. And all the time she's there, they're saying this is going on after she delivered her second child. And they ignored her for over 8 hours. And by the time they went in to do the surgery, she had about, I forget how many liters of blood in her stomach and died. And so these are not the expectations,
We have actually a trailer that we want to premiere right here at the KJLH Women's Virtual Health Expo. Thank you for showing us the trailer. Everybody want to take a look? Here we go. Birthing While Black, the documentary.
The most disrespected person in America is the Black woman.
It was 2016. I was very excited. I was pregnant with my first baby, and we were just ecstatic.
Took the pregnancy test, put it down, came back and looked at it, and I was like, does that say pregnant? Okay. My husband, he just let out this scream of happiness.
I wanted to do exactly everything right to make sure that this baby would be taken care of all the way to birth.
I tagged her and swaddled her, and we said goodbye.
She was so cold. She just couldn't look me in the face and say, Elijah is gone.
African American women are often kind of overlooked when they express their concerns.
So now you tell me he's dead? How did that happen?
We're not all Serena Williams. We're not all going to be able to fight for ourselves to that point. We don't have that money that she has.
I begin to notice blood in the catheter. The staff at Cedars-Sinai Medical Center tells me that your wife isn't a priority right now.
When I arrived, I went to check in, and no one really made eye contact with me.
I kind of feel like me asking additional questions made people feel like I had an attitude.
Women all over this country deserve better.
Every time I was in the room by myself, The nurses would take that opportunity to try to force me to agree to something, force me to get an epidural, agree to a C-section. I did not feel like they had my best interest.
As soon as the emergency doors open, the doctor says, whatever you do, please don't push. Too late. I gave birth and I caught my own baby.
First things first, every Black woman needs a doula or a birth advocate.
The doula service that we're offering, all the doulas are African American. There's something that just comes with us sharing our Blackness that kind of puts people at ease.
When I complain of pain from jump, my doctor should have looked into it.
African American women are more likely to die during childbirth.
African American women need to lead the charge.
Do not back down. Our babies are dying and our mothers are dying. Fight for your voice to be heard. Stand up and make them listen, because Black women, we deserve to be mothers.
That's definitely going to be an amazing documentary. And I think it's going to shock a lot of people. And I think it's going to educate a ton of people. And I'm glad that it is finally, that Black women's stories can finally be told in such a way. Gwendolyn, I want to talk to you for a minute here about, well, you know what? I want to talk about this doula thing first. I want to talk about the differences between a doctor, a nurse, a doula, and a midwife. Did I miss anything? Did I miss? Okay. So I don't know who I should go to on this one. Raena?
Michelle, for sure.
Michelle. Okay, I was looking at Michelle. I was like, I think Michelle. Okay, educate us, please.
Okay, Tammy. And also we can add lactation consultant into that too, because that's another.
Yes, you're a lactation consultant.
I'm a lactation educator, and then there's a lactation consultant. So those are two different things again. So I will.
Y'all just blowing my whole mind. Now I want to have a baby, so I can have a lactation consultant and a lactation, and I want a doula. I want a midwife. I want a baby.
The village, yes, the whole village. So, you know, a lot of people think that. Okay, so we know the difference between doctors and nurses, right? So the doctors are the ones who diagnose and prescribe, and you know, they're the ones who actually, you know, facilitate like these procedures, these surgeries, and things like that. And the nurses, you know, the nurses are there for patient care, but we have to, as a nurse, you know, the doctors have to give orders for the nurses to follow, right? So nurses don't typically come in and just do everything. It has to be under a doctor's order. So that's the difference between doctors and nurses. So similarly to, you know, midwives and doulas. So midwives are like equivalent to an obstetrician. So if you're a pregnant person, you can be under the care of an OB, or you can be under the care of a midwife. The midwife can diagnose, prescribe. The midwife does your prenatal care. You would have your visits with that midwife.
So the midwife is equivalent. I'm just trying to follow. The midwife is equivalent to a doctor without a degree.
Well, midwives have licenses, they have degrees. You have to have training to be a midwife, and it's extensive training. It's not just, you know, passed down like, you know, the granny midwives, it was passed down from generations to generations. And then here we go back to slavery and what happened to the granny midwives and how birth was medicalized. However, I'm going to try to stay on task.
Okay. Although that's on point if you ask me, but okay.
But so, you know, midwives go through extensive training. So you have nurse midwives who work in hospitals, and then you have CPM, certified practicing midwives who work in home births and, you know, at birth centers. But you don't have to have an OB and be under the care of an OB. You can be under the care of a midwife. So doulas, we're different. We don't do the medical stuff. So as a doula, I can't diagnose anything. I don't monitor fetal heart rates. I don't do blood pressure checks or any type of, you know, vitals or anything like that. What I provide is informational support in the terms of I will explain to you any and everything that has to do with birth, labor, prenatal, postpartum, even fertility. I work with clients who are trying to conceive and having issues. So as a doula, I'm providing you with all the education, all the resources that you need to be successful, right? You know, we help with birth plans. We help with prenatal breastfeeding. So a lot of people don't think about the fact that if you choose to breastfeed, we need to start educating you on this prenatally before the baby comes, not once the baby is here. So that's where the lactation educator piece comes in also. And so, you know, we also provide like emotional support. So, you know, pregnancy is one of those things where, you know, we've all, you know, a lot of us have been through it. However, we don't know how to support each other sometimes. And especially as strong Black women, you know, it's just like, oh, okay, pregnancy is hard, you're in pain, suck it up. Like, that is never something that I will say to a pregnant woman. I want to know what's wrong, how are you feeling, why are you feeling this way, and how can we address it? Because any stress that mom is feeling, that baby is also going to feel. So, you know, we provide that emotional support. And then the physical support, it comes in the form of things like, you know, that touch and massage, you know, pain management, giving alternatives to using medication. So, you know, we help you labor. If you want to have a natural birth, with, you know, all birth is natural, but an unmedicated birth, you know, we can help you manage better and reach your goal. But if you want to have a hospital birth, a home birth, or a birth center birth, your doula can be there. So we don't just support like, you know, this hippie, like, you know, birthing at home without medication. This is about making sure that you have the right information, so that you can make the best choice for yourself and for your baby. So,
and I think when people hear a doula, that's exactly what, like, you hit it on the head, Michelle. They think this hippie woman who comes in and puts me in a swimming pool, you know, the little mini swimming pool, and helps my baby along.
And so a lot of what we do is like, we meet you where you are, and informed consent is a huge part of, you know, what I do. I want to make sure that my clients, any birthing person that I come in contact with, is informed, so then they can consent to the things that are being offered to them if they so choose. But if you don't know, how do you have informed consent if you don't know? So if something is presented to you like an intervention, and, you know, you have this provider saying this is the best thing for you and this baby, and you really don't know what that is, during labor is not the time to be trying to figure that out.
Ooh,
so
you're absolutely right.
To prepare you before we get there, so that when the providers come in and they offer you things, you know what those are, and you know if it's something that you do or do not want for your baby.
It's kind of like having a lawyer with you.
We advocate. We're advocates. And
like,
you know,
do you want this epidural? I'll talk to my lawyer. Talk to my doula. Talk to my doula. I don't know what I want. I have no idea.
and so we try to avoid it being like that in that situation. So we like to talk about, do you want the epidural beforehand? And, you know, so you have a mom who says, absolutely not, I don't want any medication. However, I need to know what is your, like, we can call it a safe word or what have you, but at some point you might change your mind. And how do I know that you are very serious about changing your mind? Because that's an option, right? So you might have gone into this saying, I don't want any medication, I don't want an epidural, I just want to, you know, just thug it out, and that's what I'm going to do. But then it gets rough and you can't handle it. If you need something, please say what you need. And if they are not listening to you, then I will help them hear you better. So, you know,
you make me want to have a baby, Michelle. Now, oh, I think I'm too old though. I don't know. I think I would really stress you out probably at this age. I'm in my 40s, so
trust me, I have experienced some things. But then on to the lactation educator. So, you know, that is, you know, a person who can support breastfeeding, educate you prenatally, and work with you once the baby comes. However, some issues require a lactation consultant. A lactation consultant is more hands-on, whereas as an educator, that's what I do. I provide the information, I educate, and I help support. But a lactation consultant can diagnose things like tongue tie, lip tie, you know, different things that might go on with a woman's breast, like mastitis and things like that. and help to treat those things so that you can be more successful at breastfeeding.
And that's interesting because Mashariki was saying how there are times when women are giving birth in the hospital and the doctors or the nurses immediately say, oh, just give them the bottle after birth. And for Black women, they don't find it as necessary or important for the baby to latch on to the Black mother. And so it's interesting that there is a lactation consultant and educator. Now, I cannot talk about this without talking about the cost involved in something like this. What Black mother in this day and age, is, in particularly in this time, I mean, people are losing their jobs. We've got the COVID out here. Things are not looking too bright in terms of the economics of America. So who has the money and how can we afford a lactation consultant, a doula, a midwife, a lactation educator? How do we get money for that? How do we get access to a resource like such?
I'd like to speak to, so Adjoa was talking about AAIMM, and it's this network where we put, like she said, the government agencies and all of these different, even providers, you know, we have insurance providers. We've all come together to say that we know we have these problems. Folks can't afford it. So we're raising money. We have dollars. We have state money. We're doing all these different things to at least start. So like the doula program that Michelle's talking about, where they're seeing over 200 women, that was free to them. The community doulas, who are all Black women, they were trained to be lactation educators, and that was free to them to get that training, as long as they provide this service, as long as they provide that service, you know, to the women in the community. So you're absolutely right. These should not be, you know, privileged things that only privileged people can get. They should be rights, and that's what we're fighting for, and that's what we're trying to ensure. So it does take us all together. It takes you know, for funders and people who do philanthropy to really pay attention to our work and trust us, because we've been on the ground doing this. Trust us, you know, to invest in the work that we're doing, because we are moving the needle. Of all the things we've heard so far, there are solutions. We're doing so much. We're nationwide. You got Black Mamas Matter and all the organizations underneath that. I mean, you've got all kind of community partners and allies. We don't want to scare Black women. They can have joyful, happy births, even if they don't have a lot of money. And that's why we continue to push.
I want to talk. Go ahead. Go ahead, Adjoa.
I was going to say, so yeah, what Raena is saying is that the program that Michelle is the program coordinator for is a free doula pilot program under Department of Public Health with whole person care dollars to provide free doula care for African American women in LA County. Now, additionally, HealthNet has a pilot program. I believe they have a limited number, and these are, but doulas that are providing the services are Black women providing them to Black women, right? But then Raena and myself, along with two other colleagues, also went and did a fellowship on last year with the Women's Policy Institute under the Women's Foundation of California to become, to create a policy of some sort or a motion to advance the care or the need for doulas, so that we could look at, as the public health department or as the Board of Supervisors, LA County Board of Supervisors, to support or, you know, get behind this doula motion to ensure that doula care is provided as through Medi-Cal. So it's a free for all Medi-Cal enrollees, that they would be able to receive a free doula that is covered.
It is now, or it
no,
is
that was the plan.
That's the plan. Okay.
So that was the plan. So actually, Supervisor Hilda Solis and Supervisor Mark Ridley Thomas put that motion, the policy that we created, put that into play. And so on January 28th of 2020, the board motion passed for doula expansion. And so now the reply is going back to the board to see how can we get, like Raena mentioned, healthcare partners, how can we get philanthropists, how can we get Medi-Cal to say, yes, this is an important service. Doulas have been known and have had great success with reduction of C-sections, great success with birth outcomes for Black moms and infants. And so here, why can't we have this service offered to especially those that are most impacted, who are receiving Medi-Cal, and then get the healthcare partners involved too. From all the managed care providers. We have other like Anthem Blue, they're doing something as well. We want to get everyone involved. Kaiser, who else sees the need and the benefit of reducing the birth outcomes for Black women by providing these advocates? If other folks can have promotores, if other folks can have community health workers, why can't we have the same application of advocates that are going to support and ensure that lives are changed and we have successful pregnancy and birth outcomes? And so that's some of the work that we're doing. We did take it to the state. There was a state bill, AB 2258, but due to COVID, that has been put on hold. So we had a collective that was pretty much started by, name the group.
National Health Law Program.
Yes, Amy Chin and Alexis Robles. And then we had some other colleagues from across the state in Northern California, Dr. Zia Malawa. Black Women for Wellness is involved in it, Nurbese Nana Flint, and a number of people on our team, Diamond, Lee, just a number of colleagues across the state that came together for this bill and policy, and it got held up right now due to—
Speaking of policy, I do want to take this in another direction because, as I mentioned earlier, Hillary Clinton talked a lot about Black infants and the mortality rate in the Black community. It's now become a pretty big issue politically. So Gwendolyn, Mashariki, maybe you all can speak to the political ramifications or what we should do as constituents to find candidates who are on our side when it comes to what we are talking about right now, and that's the health of our Black infants and mothers.
Yeah, there's several things. I mean, one, on a national level, there's the Omnibus Act. So there's a collection of bills. I think there's 8 or 9 that are addressing maternal mortality. And so you're looking at implicit bias. You're looking at better collection of data because, people want to not act like the disparities don't exist because they don't have the data, but better collection of data, respectful care. And these are, and so this bill, this collection of bills, making sure that your representative is supporting the bills in that are brought forth not only nationally, but also too on the state level, that'll improve birth outcomes and that'll support Black moms. We have SB 464 that Senator Holly Mitchell was an implicit bias bill. So it's a Dignity in Pregnancy and Childbirth Act, and that mandates better collection of data for pregnancy-related deaths. And also too mandates that all people have the right to respectful care free of discrimination, and that if that doesn't happen, you know how to make a complaint. And also too mandates that all maternity care providers have training in implicit bias. So it's really like, what are the laws that are happening both nationally and statewide, and are your representatives supporting these? And then you look at what are some of the policies that can happen that support families. So it's not just when you think about health, but things that can support families in terms of paid family leave, in terms of, Marcia Dimes has been a big supporter making sure that Black infant health is always funded. And so when you see the budgets that come out and if our programs that are impacting the health and supporting Black families are on the cutting board, what is the organization, what is your representative doing to make sure that these programs aren't being cut, that they're supporting legislation that will support moms and babies and families, Black moms and babies and families.
So one more time, Mashariki, one more time, because some people may want to write this down. So tell us what those bills are that we should be looking for, just kind of succinctly.
Sure. So the national is the Omnibus Act, and so it's a collection of several different bills that address maternal and child health, and specifically around maternal mortality. Okay. And so you can go in and look up the Omnibus Act and see how your representative, whether they're supporting that or not. Okay. SB 464 is a statewide bill that was put forth by Senator Holly Mitchell and also sponsored by Black Women for Wellness, and that's the Dignity in Pregnancy and Childbirth Act, and that one mandates implicit bias training. And so, when pregnant people are out there getting their care, they should be asking their doctor, or their midwife, did you have this implicit bias training? Which training did you take? What did you learn?
Oh, wow. That's good to know. That's good to know.
And so it's mandated. It went into effect at the beginning of the year. And so, when you're out there talking to your doctor, you should ask them about that. And then also thinking about policies that improve access to care and quality of care and just quality of life, right? So whether it's bills around paid family leave so that women and families have the opportunity to stay home after they've had their baby. And we know that when you're able to stay home, that you have better outcomes for mom, baby, and family, and then women also to return to the workforce when they have the opportunity to stay home and get paid and take care of their babies. Also looking at bills that making sure that our doula bill gets put back up, right? And also improving access to, midwifery care as well. And there's a new bill that's coming out that's looking at telemedicine health around maternal or mental health, so making sure that folks have access to telemedicine around mental health. So those are just some of the bills that we can look out for.
Thank you. Gwendolyn.
Yeah, so I've been doing a lot of work in the last few months as it relates to COVID and as well as the whole structural racism challenges that we're dealing with. And I would say that just in the work alone that I'm doing, I've really been made more aware of the types of information that's coming down now around maternal health and infant health as it relates to these current issues. And I'm looking at today as this is like the new civil rights era. We have got to be making sure that we're including information about Black infant and maternal health when we're asking for anything related to structural change. I mean, it's easy to talk about what Black people need in general, but it's little Black lives that actually are the beginning of Black life.
Absolutely.
So we've got to start thinking about ways that we can make sure that messaging is being included when we are advocating for, changes to whatever society, norms are right now versus what we know and we've known for centuries, what's really needed in the African American culture and what's needed to sustain health for Black babies and moms.
Yeah, and a lot of times what happens is because, politicians like to go in on a sneak tip and do stuff, and they will cut a lot of our funding, and we will not even realize that certain programs have been cut or the fundings for those programs have been cut because whoever felt like, not necessary, don't need it, didn't do anything. The doula program, what's that? So how do we prevent funding cuts from even happening, Gwendolyn?
So can I just also, so let me add that I think a part of our strength is in our connecting to community. And so when we think about the messaging that's necessary, so that messaging has been coming from us. Our program has been around for 31 years, but who knows that? So now we got to get more strategic, right? So we've got to get more connected to the messengers of our community. Thank goodness for KJLH radio, because this is how we get the advocacy we need to be able to sustain the messaging that we've had for years and years. And so it's support from advocates that are beyond our work, the stakeholders that's in our work that hold our space with us, but also connecting with people that can connect with people. Because once it's on the radar that we exist and we have these needs, and these needs are like incredibly fun, like it's unbelievable when you look at the numbers of what's happening with us statistically as Black people in health in general, but particularly maternal and infant health. Once that's known, we're going to be able to galvanize a lot of support, a lot more support, I believe. And then that's what changes the shifts. That's what starts to shift the paradigm. Now you can't just so easily walk in and say, we didn't know about this. Yes, we do. We know, because now the message is out there, and it's out there in a really big way. So that's kind of what my passion is around right now, is linking our work to voices and to thought partners, but also to influencers that can really help us sustain ourselves in this space.
I want to do one final one last round table here, and get the answer from all of you. And that is, what are your suggestions for Black women to ensure a healthy pregnancy? And I mean in totality, healthy with themselves, healthy with their child, and healthy with both of the bodies of themselves and their child. I don't even know what I just said, but y'all know what I said. Raena, let's start with you. How do we have a healthy pregnancy?
Sure, I think it's a twofold thing, and I can make it very quick. One of our beautiful midwives, midwife Debbie Allen, always says, Black women need to plan their pregnancies and births the way we do weddings.
Debbie Allen is a midwife?
No, it's a different Debbie Allen.
Oh, I'm like, why is she dancing and a midwife and dancing and delivering babies, Tom?
This Debbie Allen is equally impressive. And
yeah, she is. You're right.
Yes. So the first thing is that plan. We go through we do a lot of research. We get the best of this, and we do a lot when we're having, weddings, graduations. So that's first. And the second thing is, it's not all on us. It's not just on Black women. Like they said, this is a village opportunity. So all of our stakeholders, the doctors have to really take accountability. Partners, fathers have to really take accountability to be support partners. Get educated on this. And we don't make you do it all yourself. We have a website, blackinfantsandfamilies.org. Even with all those, bills that you mentioned, soon that'll be up. A lot of this stuff will be up. We want to make it easy for you to come join us in our AIMCATS community action teams, and we can plug you into all the ways that we got to wrap our arms around it. A Black woman cannot do it alone in isolation. That's not the way. So I think those are the two things. Us as a village and community doing all of these things to support all of our funding getting involved, and then women and birthing people really taking ownership and trusting their voice and advocating for themselves.
Michelle, go.
Okay, so, like Raena said, that village. So, making sure that a doula is a part of your village and a part of your care team. So if you are a Black woman who is pregnant in Los Angeles County, you can have a free doula. All you have to do is call me and say that you want that. Simple as that. Like, I literally answer the phone, I talk to these women, I find out what's going on with them, and I connect them with the doula. So
you do realize this is about to, millions of people go see this, right?
Yeah.
You want to give them an email or a website, Michelle?
So again, blackinfantsandfamilies.org. They can be connected to the doula program through blackinfantsandfamilies.org. But also you can email me directly at msanders@ph.lacounty.gov. So self-referrals, providers, other organizations, if you know a pregnant woman, you can send them my way. We have, like I said, 14 Black doulas who cover all of Los Angeles County, and we provide free doula support. So 3 prenatal visits, continuous labor support, postpartum visits, lactation support. We even connect you with a lactation app for a lactation consultant. And, we address all the socioeconomic needs that you may have and try to connect you with resources to alleviate stress. And that is what we're doing with this doula program. And to date, we've had 85 babies born since November through this doula program. And we have about 275 women enrolled thus far. And we are going to keep going.
And Debbie Allen will do a dance for you. Mashariki, how do I have a healthy pregnancy?
Yeah, so there's two, besides what everyone else said, there's 2 tips I want to give. Marsha Dimes has a COVID-19 birth plan, and you can just Google Marsha Dimes birth plan. It's a template to help families have a conversation with their provider about giving birth during COVID. So what your prenatal care is going to look like, what your birth's going to look like, who you can have in the birthing room with you, help around breastfeeding, and the doulas like it, other providers like it, and it really does help families navigate conversations with the providers around during this time where there's a lot of stress and anxiety around COVID and being pregnant and giving birth. The other thing I want to mention is preeclampsia and low-dose aspirin. And so preeclampsia is high blood pressure and protein in your urine during pregnancy that impacts your organs, such as your liver, your placenta. It can lead to stroke. Black women have higher rates of preeclampsia. It's about 15% of preterm births are due to preeclampsia, and it can be prevented through low-dose aspirin, which is a cheap and easy intervention. So when I hear of moms having preeclampsia and nearly dying, or moms having preeclampsia and their babies dying, it breaks my heart because it does not have to happen. Mm-hmm. And so because Black women have higher rates of preeclampsia, they should really be asking their doctors, am I at risk? Tell me about low-dose aspirin. Is this something that I should be on? And so really being able to go in and having these conversations with your doctor, making sure that you bring up things for them and that you're not waiting for them to ask you questions, but you come in there and you ask them questions as well, right? And you demand accountability for them to take care of your health. So those are two things. So you can look up the birth plan, Google it, and then also to talk to your doctor or your provider around preeclampsia prevention and low-dose aspirin. And it's something that we're trying to make sure more providers are talking to their patients about and getting more community awareness as well.
Let's go to you, Gwendolyn. I want a healthy pregnancy here. Make me have one. Help me.
It's really, really simple. Enroll into the Black Infant Health Program. And you can do that really, really easily by just going to our website, which is longbeach.gov/BIH. If you're in the city of Long Beach, if you're in LA County, that address is blackinfanthealth.lacounty.gov. And let me just say this, we enroll women into this program age 16 and up. And if you've already delivered your baby up to 6 months postpartum, you are going to learn, you're going to be connected, you're going to learn how to set goals for your life. You're going to have so many resources and supports that you won't want to leave the program, literally. And so we support women in that way from the time they become pregnant throughout 6 months, in fact, throughout probably about 12 to 18 months postpartum. And then we connect you to people like Adjoa and Mashariki and Raena and Michelle, because that's what Black Infant Health does. We are literally a sister circle, and we're part of that tribe.
Yeah, I can tell that y'all, nobody wants to leave the program because I'm trying to enter it and I ain't pregnant the first. I'm sitting over here looking at my husband on the side. I'm like, we got work to do tonight.
A Black Infant Health graduate, so I co-sign that.
You co-sign, right? Okay. And Adjoa, wrap us up. Take us on home with our Black Infant Health panel.
Take y'all on home. So what do you need to do? Get educated, become aware, know the facts. The facts of the matter are this. In the United States of America, as put by CDC, a Black woman is I'll say the reverb of Black women dying at 3 to 4 times the rate of white women, right? As a result of pregnancy-related complications. So 22% more likely to die from heart disease, 71% more likely to die from cervical cancer, 243% likely to die from pregnancy-related issues here in America. That is the facts. So with those facts in mind, we have to take pregnancy seriously. We have to celebrate Black women and their pregnancy. We have to lead them along the way in their journey. You see a Black woman, I don't care who she is. I see a Black woman, I'm like, do you have a doula? I got some information. Do you know what a doula is? And I take them through that journey. I keep the flyers in my car. Join our movement. So go to blackinfantsandfamilies.org, follow us on Facebook, follow us on Instagram, follow us on Twitter. You're going to find out everything we're doing across the county, whether you live in Antelope Valley, whether you live in South Los Angeles, Inglewood, Compton, Long Beach, Watts, Willowbrook, wherever you are.
Let me ask you this real quickly. For those who aren't necessarily interested in a doula, do you still provide services and assistance for them?
One of the other key factors we didn't get to talk about in this segment, so we'll have to come back and visit with you.
We need a part 2. I told you it's just so much.
Right, and bring our colleagues, is postpartum mental health needs. postpartum depression is key and essential because we have been so long, the stigma related to postpartum or mental health as it is itself makes Black women think that if something is mentally not feeling well after they deliver, that is something wrong with them. They don't know that that is a common factor that happens. And so we have the resources, we have a plethora, a network of folks that can provide the care and support. We have support for those who have losses. Black men, imperative. If you have gotten a woman pregnant, we need you to understand you need to be at those visits. You need to not be in the car. We need a movement that says get up out the car, go into the clinic with them, go into the hospital. Just as a doula is an advocate, you are the advocate as well. And so we even have, I'll end with this, we have a great program that started out of our South LA, South Bay AIMM Community Action Team, which is Black Daddy Dialogues. It was created by Black men for Black men. So if you are the father of a Black child, no matter what race you are, that program is open to you. It meets every second Saturday of the month virtually now. And so these are the type of offerings we'll have. You know, once you get involved, you can email me to be on our listserv, and we'll send you to whomever, all the resources and the partners from government to community, nonprofit organizations. We even have grants as doulas. I'm telling you, we are making, this thing is going big. We have support from First Five with Best Start West Athens. We're moving all over, and we're a collective. That's why all of these sisters on here, we're very connected to one another. We talk to each other and engage with one another, and we figure out ways to support each other because our goal is to save the lives of Black moms and babies.
And we thank you and appreciate you for having that goal. Trust and believe. Thank you so much, Michelle, Mashariki, Adjoa, Gwendolyn, Raena, and of course, thank you to the LA County African American Infant and Maternal Mortality Prevention Initiative for having this panel at the KJLH Women's Health Expo. I'm Tammy Mack, and you can click anywhere you like. Just click on any button. I will be hosting the Healthy Pavilion cooking stage. So if you want to know how to make a tasty, healthy Cajun pasta, then click on the Healthy Pavilion cooking stage and catch me there. Thank you, ladies, so much for all of the information. I'm going to go get busy trying to have a baby somewhere.
Thank you.
Bye.
The KJLH 20th Annual Women's Health Expo at KJLHradio.com. Presented virtually by RastAfri and Radio Free KJLH.